Hello viewers, welcome to NRG Healthcare channel. I'm Dr. Karthikeyan. I'm a pediatrician. So today I'm going to talk about Multisystem Inflammatory Syndrome in children, in short called the MISC, a dreaded complication of coronavirus infection in children. So what is this MISC? You often see in the media reports about children being affected with MISC. So MISC is a short form. It refers to Multisystem Inflammatory Syndrome in children. So this basically means that a child is affected with coronavirus infection and develops certain complications from the coronavirus infection. So this syndrome usually develops about 4 to 6 weeks after a child develops a coronavirus infection. Parents may not be aware that a child has had a coronavirus infection about 4 to 6 weeks back. The child might just have had a mild fever, a bit of cold, cough, sore throat, and it would have subsided in about 2 or 3 days time. So coronavirus testing would not have been done. So parents may not be aware that their child might have had a coronavirus infection, and the child would have recovered completely. Usually after about 4 to 6 weeks after recovery, the child might start having symptoms like severe fever. The fever is usually more than 100 degrees Fahrenheit, and other symptoms depending on which organ is involved can develop in the child. For example, if the lungs are involved, the child can develop cough, fast breathing, drop in oxygen levels. If the stomach is involved, they can have vomiting, diarrhea, severe abdomen pain. If the heart is involved, they can have fast heart rate, low blood pressure. If the brain is involved, they can have fits, or the child becomes very drowsy and confused. If the skin is involved, they usually have red rashes over their body. Their eyes become red. They can have a red and swollen tongue. So if the kidneys are affected, they can have reduced urination. So depending on what organ is involved, they can have different symptoms. So this is one of the difficulties which the parents face in picking this up early and taking the child to a doctor. So any child in this current scenario who has fever for more than 3 days, and if the fever exceeds more than 100 degrees Fahrenheit, please take the doctor and get checked out by a pediatrician. So how do we diagnose this condition? So unfortunately there is no simple blood test by which we can diagnose this condition. So it has to be a group of tests. Usually a number of blood tests are done to identify whether the inflammation is active in the child's body. An important investigation is an echocardiogram or a scan of the heart, which helps us to identify whether these children are very sick with heart muscle inflammation. So usually your doctor should be able to identify which investigation is required for your child. So how do we treat these children? So as with any disease, there is a spectrum of severity, starting from mild to moderate conditions to the very severe ones. So the mild to moderate severe ones need to be treated with steroids. So that is the mainstay of treatment in the hospital for the mild to moderate cases. The severe cases need to be treated in an intensive care unit meant for children, and they usually treat them with immunoglobulins, steroids, and a number of other medicines depending on which organ system is involved. So how do we prevent this condition? So there is nothing much we can do to prevent this condition. So we need to be alert to that the child might develop this condition following a coronavirus infection. So any child who has had a recent coronavirus infection, usually about 4 to 6 weeks after the infection, and if there is a recurrence of high grade fever, parents need to be aware of the MISC condition. Fortunately, this is a very rare event. So only about 1 in 200 or 300 children affected with coronavirus infection usually develop this complication, and the majority of them can be treated with the right intervention at the correct time with steroids and immunoglobulins. So if you find this information useful, please like this video, share this video with your friends and family. Do subscribe to our channel and click on the bell notification to get more updates like this. So I will post a link to the resources available for MISC in children provided by our government. You can go through the link and identify and know more about MISC. If you have any questions, please post them on the comments box below, and I'll be happy to answer those questions. Thank you.